Hi, everybody. I hope everyone is doing well in this lockdown. Here we are, and I'm super excited about doing this live with Dr. Bhasha Mukherjee, who's obviously had such an exciting journey. Just waiting for her to join us so that we can start this. Hi, Bhasha.
Hello,
Can you hear?
hi. Yes, I can hear you. I'm
Awesome.
just increasing my brightness so I can see you as well better.
Cool. Yeah, sorry, it's quite late in New Zealand, so my lighting is terrible, but I just wanted to start by apologizing for the delay. I'm so grateful that you've made the time, and it's just not cool that it took this long. So sorry. There was nothing much I could do as well.
Thank you as well. That's okay. It's fine.
Okay.
I'm sure whatever happened wasn't in your control.
Yeah, thanks for understanding. Awesome. So we'll just get right into it. I thought of introducing you, but you've done so many amazing things. Then I was like, maybe I'll just ask you to introduce yourself to our viewers, um, however you'd like, so we know more about you.
Okay. My name's Dr. Pasha Mukherjee. I am currently a frontline doctor in the NHS in the UK, and I'm also the current Miss England.
That's amazing. And lately there's been a lot of news around how you have put your title perhaps on hold or the commitments on hold to serve what is of course the bigger priority at the moment and work at the front line, so to speak. But before I get into that, I just wanted to ask you a little bit about your childhood. For me, I moved to New Zealand when I was 11. So I actually did my intermediate in India and then moved. And I heard, but I'm not entirely sure that you were born in India too. Is that right?
I was, yes. I moved to England when I was 9 years old.
Oh, wow. And what's your favorite
Yeah.
memory? Do you have any memory of when you were a little kid in India at
Oh,
all?
of course. So we used to live in a joint family,
Right.
with my grandparents and everything. And joint family life is, I'm sure those of you are watching, if you're from a middle class home, then you've probably shared similar things of, having that family ties. And, my grandma used to wake up every morning and do puja. And I used to join in with her and stuff. So
That is
lots of
so
memories like
adorable.
that.
That's
Yeah.
adorable. That's really adorable. All right. And so you have obviously been visiting India on and off as well, I'm sure, if you've got family there, or what was the most incredible or most memorable moment that you spent in India as a visitor? Do you have one that
There
stands
are
out?
so many. There are so many. But just give an example of this time. This time I actually was there in India for humanitarian aid work, and I was traveling to several different states, and Calcutta was my last destination. And I
Right.
hadn't been to India in 4 years. And
Wow.
I landed in Delhi, and on the very first day, someone got me some Rasgulla. Do you know what that is?
The way you say
Ras-
it is so adorable because I would say rasgulla, but like I've got friends who say it just like that, and I can't even say it like that. And I'm pretty sure that's how you're supposed to say it. I love rasgulla. Oh my God. I absolutely
Yes,
adore. Yeah,
and
sweet.
the thing about rasgulla is that you have to have it fresh. You
Yeah.
can't, they just can't make it like that in the UK or anywhere else. And I had rasgulla after 4 years in Delhi, not even in Calcutta. So I was just, I just enjoyed that rasgulla so much. I still remember it. I had it on the first day that I landed.
Right. That's awesome. All right. I thought like before we get into because I really do want to discuss what it's like on and out, in and out of the front line. But I thought before that we'll just do like a small icebreaker with you. So I had a couple of rapid fire questions for you. So if you could just like tell me whatever comes into your mind first, that's basically what you have to do. So the first question is your favorite Indian dish.
Biryani.
Oh my God, same. Favorite song.
Favorite song? All the full soundtrack from Mehuna.
Oh, oh wow. Okay, interesting. The
I
weirdest
mean,
question.
that's on the top of my head. I have other songs as well. I mean,
Yeah, yeah, but that's the point. It's like whatever comes in top of your head doesn't have to be
yeah,
like, the
yeah.
ideal answer or whatever. Cool. So the weirdest question a patient has asked you.
Oh, if I would marry them. Yeah.
Which which nicely brings me into my next rapid fire question, which is like the funniest pickup line you've ever heard.
Oh, and you know what? Here's the funny part. I don't get pickup lines. I get straight Didi zoned. There are so many people on my Instagram that call me sister and Didi. It's so insulting. I want to get have pickup lines used on me, but for some reason I keep getting sister this and that. So there you go.
Oh my God, I find that truly hard to believe because you're absolutely gorgeous, and I'm not even a man, and I still feel like hitting on you. Just joking. Okay. What about okay, your favorite superhero and why? If you have
Oh,
one.
Iron Man, obviously, from the
Why is that?
Marvel Universe, because he died for us. Yeah.
Fair enough. Okay. The last one. If you could be any animal, which one would you be and why?
Cat. I think they have the best life. They're cute. Everyone loves them, and they're so soft, and they get to sleep like 16 hours a day. That's my favorite hobby anyway. So yes.
Fair enough. Oh my gosh. I would do anything for extra sleep right now, even though um, a lot of us are having extra sleep. So awesome, cool. And I could actually relate to a lot of that. Um, I messaged you earlier and I asked you to keep a couple of objects handy. I'm not sure if you
Yeah.
got around doing that, but
Yeah. Yeah.
what's the one medical text or like reference that you're referring to lately a lot? Do you have one?
So this
Can
is
you share?
I'll just show you the book. It's called Pocket Prescriber, and I
Oh,
have a
cool.
little side bag at work that I always
Yeah.
carry with my pen and my notes and things like that. And I have this with me. This is the best thing, because I don't know about your hospital, but our hospital computers are super slow. So if I want to do a quick search of the drug dosages and things like that when I'm
Yeah.
prescribing medications on the ward rounds and stuff, it takes forever to use the computers, and it's really handy because it has some of the most common medications on there and the drug dosages. I love it, and this is the one thing I've been using the most recently.
Oh, that's amazing because I read somewhere that you graduated last year. Is that
Yes,
right?
July
Yeah.
2019. Yeah.
Okay, so I graduated in June last year, so sort of like the same time. And
Yeah.
unfortunately, I'm still using the Oxford Clinical Handbook of Medicine. I don't know
That's
why.
too
Like
big. I have
it
those as
is
well, but
actually
those are
true.
too big. Yeah.
Yeah, and I sort of managed to fit it into my lab coat pocket, but now the pocket's just sagging because of it. But oh well. And the other stuff that I asked you to keep aside, if you had to only survive on like two products, like two cosmetic items, which two would you choose? I know it's like a terrible question to ask and it's not even practical, but just out of
Okay.
curiosity.
Right. So I have two that I kind of live by. I mean, obviously, if I had to choose two,
Yeah.
then it would be like a pinkish lipstick like this
Okay.
because you can double it. And I do always double lipstick for blush. And I think
Right.
it makes my skin looks amazing as soon as I put this on.
Yeah. Hmm.
It kind of hides anything else that draws attention to my lips. And this product that I've been using forever is the Maybelline Eraser Eye Concealer
Oh my gosh. Okay. Yeah, I've
in
got that
in
too.
in in nude.
Incredible.
It's the best thing for like
Yeah,
Indian skin tones, and
absolutely.
I just use it anywhere, even as foundation. Instead of foundation, I sometimes use this. So
Yeah,
I'd probably go for these two.
that's actually really good. So mine's actually yeah, so I'll share it as well. It's a lip balm and a kajal because I have a bad case of sleepy eyes all the time. In fact, I've actually like put some concealer on to like avoid showing that right now. But I've actually got a bad case of sleepy eyes when I work, and so yeah, I go for kajal and lip balm. But I think I might try the whole lipstick and using lipstick as blush. Oh my God, that's such a good idea.
Yeah, I can't live without lipstick.
And you've got fabulous lips, so you shouldn't live without
Thank
lipstick.
you.
Why not? Yeah, sweet. Now, I thought I'll just get into a wee bit of what's been happening outside. the frontline situation before going back into the technical stuff. Uh, I don't know what's going on in UK exactly, but in New Zealand we're managing to sort of contain things now. What's the situation like in the UK?
I've got to say, your Prime Minister has come forward as such a successful leader for your country. We're hearing so much about her, and it's fantastic what she's doing. I mean, UK, on the other hand, unfortunately, we've got the second highest deaths in the whole world, and UK's tiny. You know, it's really sad that after USA, UK is second. But honestly, I think for us at the front lines, the worst was never the peak. The peak wasn't even the worst, because I think the government really equipped us, and they suddenly became very vigilant, and they did lots of things to support the healthcare system during the peak. And now that we're coming off the peak is the restoration period. You know, we're returning back to normalcy and how the hospital used to run like before. This is the difficult part, because now they're sort of pulling out some of the perks that we had before, you know.
Yeah.
And I think we have to pick up on all the things that we were putting on hold before COVID-19. So I think this is going to be more difficult, returning back to some sort of normalcy.
Yeah, absolutely. Before I ask you my next question, I just wanted to say hi to Saman. She's here. She's listening as well, and she says hi, Bhasha.
Hi, Suman.
Yeah. So, okay, the the most recently, I was so impressed by what I read about you on the news. The fact that you've got your priorities right, and you absolutely are doing justice to the profession and treating it as a vocation. What made you decide that you wanted to put your Miss India title commitments aside for now and sort of pursue being a doctor and working at the front line?
I mean, medicine's always been my first and foremost love, so to
Yeah,
speak. And to be honest, I didn't see this as a putting Miss England stuff in hold. A lot of the commitments I had as Miss England, they weren't going to be possible during lockdown
right,
anyway.
right. Recognize.
And at a time like now, did I really want to sit at home? And when I knew I could be of help, that's how I felt, that, you know, I
Mm,
know that my services would be useful at this time, and
mm.
every single extra staff member is useful right now.
And
We're
crucial.
having to work many long hours now. That just goes to show that there is definitely a need for every single person. Retired doctors have returned to work. So I just felt a sense of that duty, that, you know, that loyalty that you feel towards your colleagues and your friends, that you want to be there with them, take that, you know, share the load with them. That's how I felt.
Yeah, that's fair enough, and that's so like admirable. And I think I can totally relate to that. However, I'm not sure how much you know about what's going on in India, but recently in Kolkata, I think it was, I'm not entirely sure which place, but a lot of the nurses especially are resigning at this time. And I understand that the working conditions in different countries are obviously very different.
Mm.
But for those who are listening at the moment, because I do know that a lot of medical students follow me, and I'm sure they follow you as well, and a lot of them are from India too, what would you tell them to motivate them to stay at the front line and keep working despite the odds?
I can totally understand that, how it feels to not feel supported by the governments, your employers, by the managerial part, sort of things. But we really have to think about why we wanted to do this job in the first place. And the core of it was our patients, and they need us. And the
Yeah.
truth is that even now, we're even on a really difficult night shift, when I go in the middle of the night and I'm the only person who can give that patient some comfort, and you see how much so your patients need you. That's the only thing. Even if you think this as a free service you're doing just for good karma, you just, I would say that really think back to the time when you wanted to do this job, why you wanted to do this job. At a time like now, we are the only profession per se that have job security as well. So we should always be grateful about that as well. You know, of course there is dangers of it, and we need to take the necessary precautions. But if all of us started acting like that, we started resigning, then how would we feel if we got unwell and there was no doctor or nurse there to look after us? You know, we can't have that mentality of, oh, I'm not going to do it because this is not right, that's not right. We have to think of the patients at this time.
Absolutely. And I think, like you said, we should be grateful that we are we are the profession that's counted on at the moment, and we have job security. And if not now, then when? This is what we're here for. So I absolutely agree with that. But just talking about the community at large, in New Zealand now, we're lockdown level 2. I mean, sorry, yeah, sort of level 2. So we're still out. We can still get out and about. What is it like in the UK? What is the vibe like? Are people still worried and scared, or are they hopeful?
I think people are there's definitely a lot of frustration that people are having in their homes. They're stuck at home and they feel very frustrated. So we are seeing that people are not being as compliant with the lockdown rules as they were like last month, for instance. And to be honest, yes, people are hopeful, but also it's slightly worrying for people who have got, small businesses and things like that, because if the economy crashes after all this is over, I think people are really worried and on edge about how it's all going to impact families and just people in general. And yeah, I'm worried about that as well, personally. Yeah, it's one of those situations.
Yeah, that is true. People are also overdoing, I think, this is my opinion, they're overdoing the whole immunity aspect, where they're just loading themselves up with vitamin C and just loading themselves up with all of these things. I believe in sort of taking care of yourself, but what is your take on building up of immunity, just like concentrated sort of building up of immunity?
So
Okay.
I genuinely think that there is no, as yet, we don't have any proof that vitamin C or vitamins in general are going to give you immunity against this virus. In fact,
Absolutely.
every individual is reacting very differently with treatments as well. That because this virus, we're learning more about it every day. But what you can do is take preventative measures, which is exactly what we're asking everybody to do. The social distancing thing, that maintaining 2 meters distance with everybody, including family members, the hand washing, the not touching your face, those are things where you actually prevent the disease from even entering your body. That's the best thing you can do for yourself. And optimizing your immune system by, having a routine. Now is a time when most people are going to be really slacking and finding it difficult to maintain a routine, like a sleeping pattern, a healthy sleep regime, healthy eating, exercise, enough fluids and stuff. Now is a time that if people are most likely to fall in those respects. And if anything, I would say do that. Focus on that. Focus on being your healthiest with the bare minimum, really, which is looking after your sleep, food, water, and exercise. That's it.
Yeah, that makes sense, because I think immunity is something that you sort of already have to some extent. Obviously, some people have it a lot more than others, but it makes so much sense to just maintain what you've got innately, as opposed to try and just push things into your body in the hope that you sort of fight off the virus. And preventive measures are, of course, very important, which brings me to the next sort of myth buster situation, where a lot of people, there's a trend going on where people think making masks at home and using homemade masks are effective. I just want to know what your take was on that before I comment on that.
So masks are great because the thing is that you're not really looking for a mask that's going to stop the virus getting to you, because there's a proper protocol to have testing the masks out. Even the N95 masks, when we have to wear them, we have to make sure that they actually are protecting us. There's a full seal, and there's a whole test for it and everything. And if you don't test it, then you might as well not wear it, you know.
Exactly.
And obviously, just buying a mask and wearing it is not going to solve the problem.
No, yeah.
Making a mask at home is not going to solve the problem either. What the mask is effective for is stopping your own, you know, spit particles and droplet particles, or even the tiny water droplets, in case you are carrying the virus, because you become symptomatic after a few days of actually having it in your body.
Right.
It stops you from spreading it to others. But the main thing is that you make sure that you maintain everything else as well. Just wearing the mask does not solve all the problems.
Yeah.
Just wearing a mask, the same mask over and over again, doesn't solve the problem. You've got to wash the masks. If you're wearing your homemade masks, wash them every time you go outside and come home again. You've got to do these things, you know, make sure you don't touch your face when you're wearing the mask. A mask doesn't solve all the problems. You've got to follow everything else with it.
Absolutely. So there's a lot of technicality that goes behind using a mask, how to use it, how to dispose it off correctly, and using a mask and not doing your hand hygiene is no longer makes the mask effective, etc., etc. So yeah, I just want to touch on that because masks have been like something of a topic for everybody. So I thought we'll clear that out. So thank you for that. Okay, now moving a little bit. Oh, before that, so I actually asked a couple of people on my page if they wanted me to ask you anything in particular, and I thought two questions were really good. One was that for children, what's happening right now, as adults, even as doctors to some extent, it's a very new sort of a new thing to be dealing with. We're still learning so much about it, and as doctors, we should be knowing more than everybody else. And even if we do, we still feel a bit lost at times, especially when it comes to the management of symptoms, etc. With the general population, they are informed, but only so much. Children, however, are totally different. They have no idea what's going on, and when they ask the hard questions, how do you suggest an adult go about answering these questions? Like, what do you feel a child needs to know at this stage to keep them vigilant but not panic? Do you have any?
Children are the best case scenario. They are not born with fear. First of all, children are not born with fear. We inject the fear into them, as they get older, they get more fearful. So they're a clean slate. The life they start now, the habits they start now, they will live with, and they will always live with that. So actually, if we are teaching them to wash their hands, to keep social distancing, to wear masks, to do all these things, not touch their face, these are great things. Even after a time after COVID-19, they will keep these as core elements of their personality almost, because when you're a child, the world you live in is your world. That's just how it is. I don't think children are the ones that are anxious at this time. I think parents are. We've just got to teach them the same way that we've taught everything else, in many, many years, in terms of how you eat food, how you wash your hands before you eat your food, how you brush your teeth after you eat your food, things like that. It's just an additional step that we're doing now. We're washing our hands more. And I already see that in children, that they know what to do, because this is just, they're very quick to learn, they're very quick to adapt. Adults are the problem. We are very set in our own ways, and it's really difficult for us to change our habits. So I think children are going to be the best at coping with the situation.
That's a really nice take on it, to be honest. So Suman actually she asked me a question right now. She asked us a question right now. She says, Bhasha, I just wanted to ask you about how would you react to a situation like what we have in India right now, where nurses are fearing and wanting to leave their services and go back home. Oh, we actually touched on this earlier. So yeah, well, I think someone just spoke about how it's important to be grateful for the fact that you're even in a position to help out. And when we studied medicine, or when somebody studies nursing or just any health profession, the whole point is to be able to do this. And this is like the best opportunity too. So Okay, awesome. So there is another person that said that I'm pregnant, and is there anything that I need to worry about or any extra precautions that I need to take in order to, have my pregnancy go smoothly and even when I'm delivering?
Yes, I mean pregnant women are one of the risk categories, and especially if you're South Asian descent, then you should be extra careful. Um, the rules are no different. You just have to follow them more strictly. That's all it is.
Mm,
The rules are the same for everybody. It just depends how stringent can you be with it. How
mm,
stringent can you get away with being with it?
mm.
When you are a pregnant person, then you have to just be a little bit stricter in following those rules, and that's all it is. As we've already discussed the rules on here about hand washing, masks,
Yeah,
social distancing, keeping that 2 meters distance from
yeah,
everybody. That's it, really. Yeah.
yeah. I think your video, because I was just stalking you earlier on your hand washing techniques, was really fun to watch. All right, so um, do you know the WHO statement where they said that they have a view where this situation may never go away? Um, what would you comment on that? Like, what do you think about that? It created a lot of fear and anxiety in a lot of people.
I don't want people to be afraid of this. We have to understand that this is not the first time that we have dealt with well, the Earth has had a major event happen to it. But what it facilitates when something like this happens is adaptation, evolution. As a result of COVID-19, there has been massive changes that governments have enforced, healthcare systems have enforced, which are going to be here to stay, just like the disease. So it's not a problem if the life never returns to how it used to be. It is going to be better because we are invariably, and a lot of people are going to start getting used to the way that we're living now, wearing the masks. And in fact, I mean, I don't know about you, I feel kind of a bit naked when I don't wear my mask. you know so
Yeah,
that's just how it is, and humans are testament to the fact that we have been amazing adapters, and
absolutely.
we have evolved, and that's why we are the reigning race at the moment. And
Yeah,
if we want to stay that way, then we have to do the same. So it's not a bad thing to think of it. I don't know how true it is. I'm sure there's going to be lots of things that are going to be positive outcomes of this whole, of us going through this and learning so much from this. Um, and maybe we'll return to somewhat a midway normalcy, but it's okay even if we don't, because we will have adapted, and there will be newer rules and we will evolve with it.
yeah, absolutely. And I think it's important to be as positive as possible because what's negativity going to bring you anyway? And that was really, like, really well explained. Before sort of moving into more of what's really happening at the front line kind of situation, I do realize that we're on the clock and you do have things to do. Did you remember that I asked you to like keep a special object, something that means
Yeah.
something to you? So in New Zealand, in Maori, we call it the taonga. It's basically just means an object that's precious for whatever reason. Mine is this wee cross here, which it's always been in the family. It was given to me when I was stressing out in my final year exams by my brother. So I was just curious to know what yours was, if you're comfortable sharing it.
Yes. So you mean you told me this morning, and I'm actually quarantining away from my home, my
I understand.
house.
Yeah, yeah.
So
So
I
whatever
don't
you've
have
got
a
with what you've got.
lot with me, but this is one thing that I've been keeping with me, and it doubles as two. I've had this diary, and I mean it's tattered now. It's got Ganapati Bappa at the front, and
So
it's my
cute.
favorite color. It's from 2011 or 12, I think, and I've had this diary since then. And to be honest, I don't really write diary entries, but
Mm.
I do sometimes write down my thoughts, and especially because I have struggled with mental health myself. And one of the best ways I found to deal with it is to write down a point system of everything that's bothering me right now. And sometimes I actually look back and look at the things that were bothering me, I don't know, in January or in September last year. And I look at them and I think, oh, that's not a problem anymore in my life, and that was consuming me at that time. And it's a great way to look back at things that, oh, this was really affecting me at that time, and I got over this time, you
And
know.
also a great way to put things in perspective, because when it's all in your mind,
Absolutely.
it just looks so much larger than it really is on paper, say, for example.
Exactly.
Yeah.
And especially if you're struggling with depression and anxiety, I would definitely say put your thoughts down on paper, offload it. You
Yeah.
know, just
Yeah.
like you back up your phone because your memory gets too full sometimes.
Yeah.
You've got to do that with your brain as well. And I've been really doing that in this diary, and I've had this for the longest time. And of course, it doubles as my good luck charm because I
Like
love
Ganpati
Ganpati
Bappa.
Bappa. So, yeah.
That is so cute. Yeah, I just thought like, I should ask you because that tells like when people answer the question about the Taonga, you can actually find out so much about the real person that they are. And um,
Yeah.
yeah, so that was really beautiful. Thank you for sharing that. Moving on to what's really happening at the front line, because you'd be the perfect person to ask, because that's what you're doing right now. What is so what are the common presentations of people that are COVID-19 positive that you've come across?
So the
Positive
test
positive.
takes 2 days to come back positive,
Right.
okay?
Hmm.
And we're seeing a variety of different symptoms, which is what throws us off. So a lot of the people that are coming in, most of them, we're sending them to the query COVID ward, which is basically where people stay for the time period when we're waiting for their test results to return. And it could be, I mean, the most common thing we're seeing is obviously fever. Fever, any fever, we're treating it as query COVID.
Right.
Shortness of breath, unless they've got something else going on that's causing it, for example, heart failure
Hmm.
or asthma or something like that. We're
Hmm.
treating it as COVID. And elderly people, if they're presenting with anything weird, like, low blood pressure and then, fever or low temperature as well, any sepsis, basically, if you're thinking sepsis, then we're definitely thinking COVID at the same time.
Right.
I don't know about people who are watching, they know what sepsis is. Do you
Yeah.
want to explain what sepsis is?
Yeah. So basically, sepsis is just like a really trying to, in a simple way, think about an infection that's just consumed your entire body and is to the point where it's actually quite fatal. So if it's not managed immediately, you're probably going to die. That's the simple way of saying it.
Yeah. So
Mm.
your body is just going a bit hyperactive and all your vital signs, they're kind of going all over the place. And that kind of usually happens with an infection. So as you said,
Yeah,
um,
absolutely.
that so we're seeing that mainly.
Right. Okay. That kind of makes sense because it's sort of the same here, I'd say. What about the management? Now, a lot of people think that the vaccine is like the end-all solution, but in reality, one, it's going to take a while, even if we're on the way there, it's going to take a while to sort of, develop one that works. And when we do, to have people get access to it across the globe because it's now a global pandemic, it's going to take forever. I
Hmm.
just I just wanted to touch on this because I was wondering if you could share your views on not not how not to think about a solution, but how to think about like a way of life that supports containing this virus. Would you agree with me?
Yes, absolutely. I think with the vaccine, as I say, there's continuous research going on behind it.
Mm,
Absolutely. But we don't know how long the vaccine's going to last, even when you get it. Is it like the flu virus, where we have to get one every year? Or, we don't know how long, if even if you've got the disease, how long does your immunity last for? All these things, there's so many different factors to be considered. And we're learning more about this disease, and prevention is definitely the best thing we can do in this situation because we just don't understand this virus well enough yet. Um, in terms of management, at the moment in hospitals, we're managing people's symptoms and helping them get better in their own rate. You
symptomatic
know,
management, yeah. Hmm.
that's what we're trying to do. We're facilitating a patient and their immune system to cope with this and get through that cycle.
Yeah. So therefore, it's basically tailored, isn't it, to every patient? What about the sort of common knowledge that, and I wouldn't really call it knowledge because I'm not sure if it's right or wrong, that people think it's more the older and the elderly people that are susceptible to the virus, and that the young people can sort of get a free pass, more or less. What do you have to say about that?
Well, there have been young people who have had very severe symptoms from it, but when numbers are concerned, yes, elderly people are more affected, but we've also got to see why, because a lot of the elderly people who are coming in based on the fact that they are from care homes where they all live together in close proximity, in large numbers, you know, and that makes it easier for the virus to be
Right.
passed from
Yeah.
one to another. Then equally, if you look at healthcare staff, we've had a variety of ages being really affected and really quite, I mean, I was asking my colleague the other day, and it's worse than your worst flu that you've had in terms of symptoms. Even if it's for 2 days, 3 days, 5 days, even,
Yeah.
it's really quite. You can't afford to take that risk. We do have patients in ITU who are in their 30s with really scary outlook in terms of how they've coped. So don't take that chance that you might be someone that gets off easy, because you might not be. You don't know what your genetics are, and viruses are really strange in that way, in the way that this particular virus, they're affecting each individual very differently.
Right.
So we have to be very careful at a time like now.
Yeah, that's very true. I'm just gonna wrap things out now, but I just wanted to, before I let you go, I really wanted to ask you, and this is kind of also because I'm curious to know, how is this whole situation sort of affecting you personally? For people watching us, we'd like to know how you take care of yourself, at work, of course, with the mask and all of that, but also at home. You've already touched on the mental health thing, which is great because I wanted to ask you about that, but you did a great job with that already. But just wanted to know how you take care of yourself and how you are coping with this situation as a doctor and as just a human being, really.
I'd like to start by saying that I'm very fortunate that some of the things that are affecting others, like the lockdown, being locked at home, doesn't fully impact me because I'm at least getting to go to work. And work, actually, you know, if you look at history as well, unemployment has been one of the biggest facilitators of poor mental health and poor physical health
Yeah.
and various socioeconomic problems and stuff. You know, people resort to poor health habits like smoking, drinking, all these things. So I'm very fortunate that I have some kind of routine to my life, day-to-day life. Also, another way I'm coping with it is by giving myself tasks, which as Miss England, I can do this at least, that I have got interviews to do. I'm constantly trying to do educational
Videos.
content for my social media for people. I'm constantly answering questions on that, and that gives me a sense of purpose when I'm not at work. And just trying my best to optimize my immune system, as I said, you know, trying to get the sleep that I need, fluids. I'm trying to keep up my fluids as much as I can.
Thanks for the reminder.
Oh yeah, I've got mine too.
I actually kept it right here, but then talking
Yeah,
to
I
you
know.
was just so interesting that I completely forgot about watering myself. Yeah. And you're also living away from home. You know, you mentioned earlier when I was messaging you, and you mentioned it again on this chat. How's that going for you? Are you quite close to your family? Do you miss them?
Yeah, I'm very, very, very close to my family, and I think I feel a sense of I am sort of the bubbly person in the family that keeps everyone on their
On your toes.
toes.
Right.
So my poor
Yeah.
mom, she gets bored at home. My brother's got his gaming, so he is occupied with his that sort of stuff. But I do feel that I do miss them, and I want to be there for them, and especially at a time like now when people are stuck at home. It's
Yeah.
really difficult if you don't have your loved ones around you. Um, but you know, we talk on the phone every day, and we try to make jokes and look forward to things. And social media is one of the best ways to do it, really. My mom
Yeah.
always, she's watching me right now, so
My
you
mom
know,
is too.
uh,
Yeah.
yeah. So, you do the best that you can.
Absolutely. And is there anything else that you would like to say? Because you've been answering all my questions, but maybe there's something you want to say that I haven't asked you, or just something for our viewers before I let you go.
I just want to say that thank you to everybody that has been reaching out to key workers and helping us out at a time like now, giving us that motivation, thanking us, saying that I especially have had a lot of messages saying, "Oh, you're so brave, well done," da 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 da. But I want to say that it's actually a privilege to be in this role at this time. There isn't a better time to be a doctor, because I know that all of us that went into healthcare professions, we all wanted to be heroes. And now we get a chance to do that in real life. And I get to see this every day in my life when, especially, so I mean, I'll just use one anecdote to wrap this up, that the other day I finished a night shift. It was about 5 o'clock in the morning that I went to see a patient, and we sort of sorted him out overnight. We gave him some nebulizers helping him breathe and stuff. And in the morning he was thanking me so much. He said, "Oh my God, I can breathe so much better." And when you really think about it, to help someone breathe, breathing is such a fundamental thing that we do
Absolutely.
every day. To be able to help someone breathe, it feels, I'm getting goosebumps now, that
Yeah.
I feel lucky and fortunate that I have been given this role, among others, to help people in a time of need and
Yeah.
take their pain away in whatever little way we can. So thank you for saying thank you to me, but I feel very privileged to be in this role.
Yeah. And honestly, at the end of this live, I can confidently say that what I thought about you on the little that I read about you is absolutely true. You are, of course, beautiful, but you've also got a really beautiful heart and an amazing mind. And thank you so much for making this time to have this live chat with me, and with everyone in the organization. So thank you on behalf of them as well. I wish you well with everything going forward, and keep doing all the wonderful things that you're doing.
Thank you. Thank you so much.
Yeah. Take care, Bhasha. Have a nice one.
You too. Bye bye.
Bye.